Implants versus crowns. I'm missing a tooth. Should I do a crown, or should I do a bridge, or should I do an implant? How much does it cost? Doesn't my insurance cover it? What is the best option for my oral health? What should I do? After watching these videos, you guys should have no questions. What should you do in this situation when you're missing a tooth? Let's dig in. I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry and Orthodontics. I get a lot of questions from parents. I'm missing a tooth. Dr. Olga, my dentist told me I need an implant, but can you tell me what's the best for me? Implants, crowns, bridges. Let's figure it out. What does that mean? And what's the best choice? So first of all, if you are missing a tooth, you can have options. One is implant. What implant is? Implant is like a little screw which goes into your gum surgically, and then we screw the crown on top of it. So implant has different parts. Surgical part goes inside your bone. Then we have like an abutment which kind of holds the crown portion of the tooth, and we screw it all together. It's actually requires surgical intervention. Okay? What is bridge or crown? So if you're missing a tooth in the middle and you have normal tooth, and in order to connect them and close the gap, we're gonna put a crown on this tooth, and a fake tooth in the middle, which would be connected. This is bridge, okay? Let's figure it out, pros and cons, and when you should have implant or when you should have bridge or a crown. So let's talk about just crowns. If you have a big cavity or big filling, or the cavity got into the nerve of the tooth and you still have enough tooth structure, your tooth is overall good, and for example you had root canal done, the tooth is weaker because there is no nerve after root canal, it's a good indication to preserve the remaining tooth, because your own tooth is always better than anything fake technically. So we're saving the tooth, we are making the part where cavity was smaller, we kind of make very small tooth, and we take an impression and we glue on a fake nice crown which would cover that gap. So that's kind of the basics of what crown is. Bridge is a little bit different. Now there's tooth is gone, right? For example, it had to be pulled when I don't know what happened, but now you have gap. So what you're gonna do, we can do bridge. So with crowning adjacent to teeth and attaching that in the middle. The third option is implant. Implant when we have that surgical part, which I was explaining. So crowns are indicated when you have limited tooth structure, when you had root canal done, and it's a still good tooth. It's a crown. Implant is, for example, you had a trauma and you missing a tooth, front tooth for example, and there is nothing left out of there, tooth was pulled, then we usually do bone grafting if we need to preserve the bone on a fresh injury, or if for example you lost the tooth long time ago and you lost the bone, then we can technically add some more bone to it and then put that surgical implant and create the crown. So they are completely different procedures. A lot of people asking like, oh my God, everything is so expensive. Well, if you look from perspective of longevity, would I choose an implant or would I choose a bridge? I personally would choose probably implant, because implant, you technically placing a screw and the crown on the missing part, you're not touching adjacent teeth. If you have to do a bridge, for example, then you have to prep the adjacent teeth in order to fit the bridge, to connect those teeth together. If you had big fillings on those adjacent teeth and you need crowns anyways, then might be a good indication for a bridge there to connect it all. But keep in mind, the problem with bridges is if one of these crowns, which you just cover adjacent teeth with, will have a cavity around it. Sometimes we call it a recurrent decay, because nothing is forever. You still can develop cavities. You can even develop cavity under the crown on where the root is. Or if the crown is not like seated completely, it still can, bacteria can get in there, it's microscopical. And then if one of the part of the bridge fails, then everything fails. So now you're not just replacing one tooth, you have to replace all three. If you choose to do, for example, separate, just an implant, and if something goes wrong with that implant, you just like losing that one tooth. What about pricing? When you do implant, you pay for an implant, abutment, and a crown. When you do bridge, you're paying crown, and the crown. Probably close to what you spend either or. The best way is to keep your teeth clean and nice and not to have these problems. But if you already have these problems, then those are the options for you. Durability and how long does it last? And nothing is forever. Implants statistically have really good results. If it's placed properly, if you keep your mouth nice and clean, if you don't develop periodontal disease around the implant, which is not very common, then implant would probably, longevity-wise, should last you a very, very long time. Compared to crowns, again, if you're not taking good care of your mouth or prompt the cavities or drinking that Coca-Cola and you can't give it up, then you might develop recurrent decay, and probably longevity of the bridge work or a crown can be shorter. So technically, if you have an implant and the crown screwed onto it, there's no choices, like you can't get cavity in there. So unless implant fail, which is very rare, then you will have a problem. To me, it sounds like implant is more long-term. Durability and longevity is better. But again, nothing comes without any pros and cons. You have to take in consideration your overall health, your overall oral hygiene, and every case is different. Positioning. For example, if we're talking about grandparents, right? If they're missing multiple teeth, then probably doing some kind of denture partial when multiple teeth are missing. Sometimes we do implant supported denture for up here, two on the here or four and on top, and then it slides in. It's a denture, so it's complete replacement. Those implants are probably the best choice for that particular population. So we need to look who is the patient and what we should do and what we should not do. For example, if you have enough bone support, if you have enough space, implants has to be placed where you have enough clearance to put the crown on. The angulation of the implant should be favorable. Also, there is anatomical structures we all have. And if that implant is placed and you have to have like sinus lift or major surgery in order to have that one implant, maybe in that particular case, bridge is a better choice. Or you have to trust your surgeon and make sure that it's a good approach and good technique. A lot of questions you should ask your surgeon, your general dentist who's doing your dental work. So for me to just tell you, oh, implants are amazing, crowns are amazing, I can't tell this to you. It all depends, and again, cost is probably similar. Depends also if you're using your dental insurance. Insurance may pick up one more. Implants, as far as I know, most insurers still don't cover, unfortunately. So probably cost-wise, your bridge work would be more accessible to you. And then how many teeth you're missing. If you're missing single or two teeth in different parts of the mouth, probably implants is better. So discuss this all with your dentist for your particular case and find those answers. Share with me, let me know, did you have any implants or bridges or dental work done, and what worked better for you? Share this video with somebody who doesn't know and confused what are crowns, implants, oh my god, all this dental terminology. It might help them. Thank you so much for watching, and I'll see you in next videos.